Good morning, and welcome to this morning's edition of Scholarly Communications Colloquium. I'm Nancy Davenport. I'm the University Librarian here at American University, and we're really happy to have our colleagues from here and from other schools as well. This is a series where we have looked at a variety of ways that scholars are beginning to change the way they communicate, change the way they actually do scholarship, and the way that libraries interact with those scholars and with each other. And we're happy to have with us today James King from the National Institutes of Health Library. And he will clarify in his remarks how it differs from NLM, which is one of the first libraries that people think about when they think about the national libraries and medicine. Team science and globalization have dramatically changed research and research collaboration. And James King, who is the library's branch chief and information architect, will explain how NIH is working to directly harvest information from trusted data sources to dynamically create researcher profiles or their CVs, utilizing researcher networking tools with the goal of fostering collaboration across the entire Department of Health and Human Services. We find this particularly interesting. We do, as last year we did the first annual conference on high impact research for AAU faculty members, and establishing a research identity and learning to manage that to bring greater impact to one's research and bring more prominence to one's research is something we're particularly interested in pursuing. So we'll pay very close attention to this part of your presentation. James and I have known each other for a long time. He is also a long-time member of the Special Libraries Association, was recently named one of its fellows, which is quite a tribute to you. He has served on several library advisory boards and received a lot of awards. He holds an MLS from Catholic University and a bachelor's in computer science from Salem International University. Welcome to you.
Thank you, Marcia. So thank you for inviting me and giving me a few minutes to talk about one of the many projects that we're working on at NIH. So let me give a little bit of background. So NIH is an agency within the Department of Health and Human Services. We're the biggest agency within that family. But that family also includes the Food and Drug Administration, FDA, the Centers for Disease Control, CDC, as well as a number of other agencies and operating divisions like the Indian Health Service, the Center for Medicare and Medicaid Services, and many others. As a group, we address the nation's health issues, either diagnosis, response, prevention. NIH is located up the road in Bethesda. We are the principal funder of biomedical research to the tune of $32 billion a year. 80% of that money goes back out the door to universities and other research centers. 10% of it goes to the intramural research program at NIH, and then the remaining 10% goes to everything else, including the fire, safety, security, the NIH library, and so forth. As Marcia mentioned, we are distinct from the National Library of Medicine. NLM is one of the 27 institutes at NIH. Their mission is to serve the public health needs of the country, and they provide wonderful services like PubMed through NCBI, PubMed Central, and others. We are the library, the research library for the 4,000 postdocs and 1,200 principal investigators, as well as the many program officers that manage the grants that NIH puts out. So we are the internal library that serves the needs of the people that work here. General public can come onto NIH and can get into our library, but our services aren't really geared towards general public. There's even a patient library that's distinct from us. So even patients that come into the building in which we work in the clinical center, otherwise known as the House of Hope, and that's where many of the clinical trials actually happen, and where experimental treatments and protocols are tested for people that have no other recourse for disease treatment. The NIH library has 48 federal employees and roughly a dozen contract staff. We actually use a matrix organization to make sure that we keep silos down to a minimum, so we don't necessarily have specific departments. We create teams every year to get all of our work done. I'm a branch chief of 2 of the 3 branches. We have a vacancy right now. But the work of the people within those branches are really done throughout these teams. So I kind of wear 2 hats. We obviously have a number of strategic initiatives as well as operational things that have to get done day in, day out, document delivery, collection management, and so forth. Let's see. So we have relationships with many parts of HHS. So we have some consortial agreements with FDA and CDC. Both of those organizations have their own libraries. But the rest of HHS, we actually serve as their virtual library. It's developed over a number of years, so we provide library services and collections and manpower to CMS and Indian Health Service and so forth. So let me see. So on to our topic. Our team has been working for the last several years to address a challenge that all of us are struggling with. How do we encourage scientific advancement in the most economical manner, taking advantage of advances in research methods and technology? We also recognize that the science of team science clearly shows us that science is no longer a solo effort, but it's done in collaboration on many different levels. Not only collaboration within departments of an organization, but collaboration between organizations, collaboration between countries. If you look at the number of co-authors in scientific papers, they've grown dramatically over the past several decades. So we know that research is done transdisciplinary and done across lots of different people, but yet many times we're still turning to traditional social networks of going to conferences and hooking up with friends of friends and stuff in order to collaborate and develop these new approaches and go into these new areas. We're finding that that's slowing down the speed of research. So how do we help NIH staff from these different disciplines to find each other, to work jointly, and to accelerate this learning curve and accelerate science? This brought us to our vision that we want to create a web-based research networking tool that makes it easy to find other people, to find that expertise of other people, but at the same time reduces the staff burden. Anyone that works in libraries or anyone that deals with researchers, you know, one of the problems we have is the CVs, the bio sketches. They're always out of date. Researchers have a hard time keeping those current, even if they come to us for like a citation count of their own stuff or figuring an H-index or something, they miss stuff. They miss their own stuff. So being able to find a way to make that easy for them to keep up to date is very valuable. And a little bit of background, back in 2009, NIH, through the National Center of Advancing Translational Services, or NCATS, funded a couple grants specifically to Cornell and Harvard to expand their profiling system. So they had developed over a number of years, they had developed internal profiling systems to automate the creation and management of CVs, to pull in publications from PubMed, to pull in grants received from NIH systems, as well as pulling in from internal HR systems, mashing it together, and then automatically having a CV. NIH wanted to foster that and go beyond those 2 organizations, so both of them received grants, and what came out of it was the creation of VEVO and Harvard Profiles. A couple of years later, NIH wanted to try them out and not only see what semantic data look like, because both of these are utilizing semantic data, which I'll talk about in a second, but also see, could we help with this? NIH doesn't have a problem of a lack of profiles. We have a proliferation of profiles. Through a number of different systems like MyNCBI, you can create a profile. In an internal grant tracking system, will have a profile. So there's a number of different places where we have profiles. It's keeping them all current, where there's a bigger problem. So we felt like there was a need here, and I've been involved with a team testing VEVO, and then I got involved with OBSSR, which is the Office of Behavioral Science Research, where they really wanted to foster collaboration within behavioral scientists, but then recognize that that's too limiting, that we can focus on getting behavioral scientists to collaborate, but you couldn't just collaborate with other behavioral scientists. So we really needed a broader system. The group that I was working with was also on the program officer side. So many of the systems like VEVO and Harvard Profiles are really focused on helping researchers. Program officers have different expertise markers that they're looking at. So if you're an intramural researcher or a PI, principal investigator, so forth, your markers of expertise are going to be the publications you produce, the quantity of them, the quality of them, and the quality is often counted by number of citations, and how your citations compare against others in the field and so forth. But if you're a program officer or a grant manager, you do publish at times, but your expertise marker is really in what grants are you managing, the volume of those grants, the duration that you've been having them, the success of those grants and the discoveries that have happened. So how do you capture that? And I'll get into that a little bit. So lots of flowers bloom over time, so there were other projects that were happening around the same time. You'll see different logos and so forth. So we've been working to collaborate with all of these other projects that have been popping up. At the same time, we worked with GSA, and GSA was having a Shark Tank type competition where we threw our hat into the ring, said we'd like to develop this profiling system for not only HHS, but potentially for the whole government. And we actually succeeded. We made it through a first round, then we did the Shark Tank type thing where we had 5 minutes in front of a panel of high-level government executives, and they drilled us on what we were proposing. And as a result, we did get some funding to start a prototype. I'll talk about the lessons learned that ended up being harder and very difficult to manage. Cross agency collaboration is not easy to do. But as a result, we have a prototype, a very closed prototype, and now we're embarking on the next phase in our efforts. Rather than relying on an opt-in system where staff manually create and maintain their profiles, like something like the old Community of Science that's still around, where I worked with that group, and I'd have researchers that had very voluminous profiles and others that had very small profiles. And the tendency seemed to be the ones with big profiles were more junior researchers that needed to get out there and needed to have their name out there, where the senior ones just left it to default because they already had their network and they didn't need to be bothered. So we need something that was more objective as well as more automated. So the focus is on harvesting trusted data sources and bringing them together, normalizing that data, and making it easy for people to search and retrieve experts, mentors, collaborators, as well as being able to go beyond. We're not just building a system that focuses on NIH, though that is our initial focus, but we want to tap into the network and be able to easily help people to expand their search. They could look at one institute, they could look at NIH, they could look at HHS, or they could go out to academia. Since so many other organizations have a profiling type system, we should be able to tap into them as well. So if I'm a program officer and I need to embark on this new research project, I need to find the best people wherever they are. So facilitating that is key. Automatic harvesting is critical. We can't have people typing in citations for hundreds of publications because we already know they're going to miss stuff. And there's so much that we can do now with bibliometrics and data mining of the published literature, implementing things like Orchid and so forth to really disambiguate authors and make that part easier. I'll also say that auto harvesting isn't limited to just publications. It's any trusted repository. I'll show a little bit later a number of different types of data sources that we'll be able to.
Jim, I have a question. Auto harvesting involves some legal questions. So you cannot just harvest any data out there, right?
True. It depends on. So yes, you can't harvest any data. So if I'm harvesting a commercial system like Web of Science or Scopus, I have to stay within the bounds of the license for that. So I could harvest it and make it available internally, or I could use whatever license they have that allows limited distribution of a portion of that for broader dissemination. Remember, I'm part of the federal government. Federal government doesn't have copyright over things. So the data sets that we have, like grants that have been awarded, that's public data. The PubMed database, that's public data. So there are a number of data sources that we can harvest and make publicly available. I should also add that we're looking at a multi-tiered system. So some of this data is going to be restricted. I don't think we're going to do it right now, but if we got to the point where we were harvesting grants in process, that's highly sensitive data. That can't, half of the population at NIH can't even see it, much less it being publicly available. So that would be restricted highly versus other stuff that would be more public. So point taken.
Thank you.
Lastly, open system. To the degree that we can, a number of these profiling systems are trying to harvest, normalize, and then expose as many data sets as possible. As we're moving into the world of data mining, creating a lake of data is step one. You need to be able to have easy access to lots of different types of data, and then your step two is to figure out, well, what chunks do you need for the project I'm working on? You filter it down. And then the last step would be analysis and visualization. So we're hoping that this is part of that effort to normalize and bring together and expose a lot of different data sources. NIH, probably like any other agency and possibly like any other organization, there's lots of silos. There's a system for grant information. There's a separate system for patents that have been awarded. There's another system for publications. And we are taking steps to at least catalog and identify all those different systems, but the next step would be to bring it together and make it easily connected so that you can start doing stuff with it. In addition, once you've normalized it and brought it into a system, then you can output it and you do fun things with it. Like if you have a single system of all publications from NIH, then I can easily make a widget or something available to each of the different institutes or even down to sections and say, these are my publications. And then it's just automatic. If they're maintaining the big system, their individual website just automatically shows no new publications that are coming out. We can also create annual review reports. So we could tie this with citation counts and be able to spit out here Dr. Jones's list of publications and current citation counts and H-index, and it's just automatically created. And then it's a trusted third-party report of the different researchers that can be used as part of evaluation. So the number of so this is thinking ahead to how do we make this indispensable. If you can get into promotion processes, then you quickly become very valuable, both in terms of administrators seeing the value, but also individual researchers seeing the value. So we've been doing research into what's out there and who are the players. It really, as it started with Harvard and VEVO. Those are the two open source solutions that are out there. Harvard has really focused on a boiled down, very simple approach in that they harvest your HR data, they harvest publications from PubMed, and they harvest grant information from NIH and NSF. They mash all that together and create your profile. Very good for if that's the main thing that you want to do. VEVO went more broad in terms of a platform that you could bring in lots of different types of information, not just those three types. At the same time, Symplectic, a UK-based company, had started building out its own profiling system and then quickly realized that there was a market for integrators. So they now focus on deploying VEVO and Harvard Profile sites and providing support for people. So instead of jumping into open source, which is a bit of a frontier in that you typically have to have a number of people on staff to manage databases and websites and ontologies and so forth, you could use somebody like Symplectic to be that service provider for you and take care of tech support and so forth in the traditional, online or cloud sense of a service. Clarivate and Elsevier, Clarivate formerly Thomson Reuters and Elsevier are the two big sources of bibliographic data So they're sitting on a landmine or a gold mine, and they recognize it. So they both have been shifting from, and in fact, Elsevier's new mission statement is that they're an analytics company, not a publisher. That the data that they're sitting on is just the raw material. But being able to analyze that and create services and show impact, that's the big thing for both of them. So both of them are creating a number of tools and services highlighting that. And Harvard and VEVO both need to go to them to get that data, unless you can just go to PubMed. If your population is focused enough that you can live on PubMed, then you're okay. But that gets to your point about public data. Both of those are under license, so by them being able to have their own tools, they can control the access and the distribution. Now, all of them have APIs to make it easier to bring that, bring bulk data in, so you don't just have to go through the human interface to download 500 records. You can go through an API and get thousands of records at a time, which we are doing. So a little bit more about VEVO. It's an open source semantic web discovery tool. It's really pushing linked open data, as I mentioned before, and it's bringing together as much public information as well as visualization. So Katty Borner, I think it's Illinois, Indiana, she's been actively involved with this, and she's done incredible work in terms of data visualization. If you have all this data and it's in a structured format and it's using a relationship model, then you can do great things with it, and you can start to make inferences and connections that weren't directly in the data. So you can see with this idea of subject, predicate, object triples, you can then start to say, and I think you'll see on one of the screenshots, well, who's near me? Or who's similar to me? By structuring as many of the data sets as possible into this format. So here's an example of one of the systems that we have a prototype of. Fauci is the director of NIAID, the National Institute of Allergy and Infectious Diseases. So for our system, we basically copied his picture and copied his bio from his real profile, but then we harvested his publication information, and from that, we can figure out who his co-authors are. So co-authorship is one way of looking at your network. Who do you work with? We can also look at publications, so on a basic level, what are the publications and how often did he publish each year? And you can drill down and look further, or you could pull in the paper or look at alternative metrics or alt metrics on each of them. You can also take that information and dump it out into a Word CV or a BioSketch in either one of the formats. And you can even filter it if you need to be more specific. Another interesting that you can do, so this is another site, but what they did is they took all the research projects that were in the profile of, let's say, a research group, and then you can map it. And you can see, well, what's the research impact, or where am I doing research? For a place like NIH, this would be very interesting to see where NIAID or NIM, where are my research projects happening around the world. So in terms of data, the key is authoritative sources. You want it to be accurate and current and reduce the need for manual input. So you want to be harvesting as much as possible and reducing the amount of manually entered information. Now, there isn't a data source for everything. If a PI or a program officer has research aims that they're focusing on the next couple of years, I don't think that's in a system. So there's going to be some stuff that you have to put in. As far as I know, there isn't a definitive system that lists all of the awards and honors that have been received by NIH people. So there's some level of manual entry that's going to have to go in. But once it's in there, then that can be mined as well. So I've listed a number of sources that we're looking at. Most of these are internal. So our HR data, Party, which is an internal system, it's been developed by a contractor, so it's bringing together a number of data sources, but it's only available at NIH. But you can see it's got publications, patents, clinical trials, the FDA Orange Book. NIDB is the intramural database of research, clinical guidelines. It's all in one place. So that's handy for harvesting, and really there's no user interface to it. The only way you get into it is using the R scripting language and go in, make some queries, and then pull data out. NIH Guide to Grants and Publications includes the funding opportunity announcements. So when there's a new opportunity, there's an official FOA. Within that, there's a SRO or Scientific Resource Officer that's listed on there. These would be helpful if I'm looking at expertise of program officers. So if I can show grants that they're on, or if they're the scientific contact for these grants, then that, again, shows where their expertise lies and where their experience has been. Developing protocols for research is important, and we have a new system for managing that process, so we can pull into that system and see, well, what protocols have you developed? What classes have you taught? So we have a graduate school, FAES, as well as a training program, so we should be able to harvest from that at some point. CORE, so Contractor Officer Representative certifications. I can manage contracts, and I have a certain core level, and I could list the contracts that I'm managing, and that would help people to understand what background I have in terms of managing contracts and the type of contract. So, for example, I manage subscription contracts and technology contracts. So, you could even go a little bit further afield and harvest the equipment inventory. A lot of it would be, you know, I'm not worried about do you have a color printer or not, but if I have a 98 port well piece of research equipment, and I'm someone who doesn't have it and I need to collaborate with that, that can be another point of collaboration, so pulling in that kind of stuff. NIH has a robust videocast service, so if I could mine that and find people that have spoken or led a conference or something, that could be interesting as well. And then SIGs. Externally, things like Web of Science and Scopus, those could be harvested within our license. We could both use Orchid and harvest Orchid, but we could also use this as a platform to encourage adoption of Orchid. So anybody that doesn't have an Orchid listed, we could say, look, clean up your pubs and then hit this button. Now you got an Orchid assigned. And then that number would feed back into Web of Science, Scopus, PubMed, and others, and help with the broader disambiguation problem. We could mine patents, we could mine national organizations. There are some databases out there about major awards. We could mine some of that stuff. And we could even mine social media and look for tweets that relate to a project that you're working on or something. Specifically looking at VEVO, VEVO is intended to be a public service. So things that I'm listing that would need to be more sensitive, those would go into an internal system, and then the public portion of it would be synchronized out to the VEVO or VEVO compliant instance. So why do we want to go in this direction? We think that it will help a lot in terms of finding collaborators for projects. Improving mentoring. So if I want a mentor, I can find someone that's expert in space that I'm looking at, or if I am one and I want to find someone that's a rising star in the field, I could go look for them. Health emergencies, so Ebola. HHS had Public Health Service. One of the things that they needed to do pretty quickly was identify people that not only had expertise with that disease, but they also needed to find people that understood Western African culture, burial practices, lots of other things that really factored into the response. If that could be done quicker and at a broader level, that would help with our response and deployment. Every year, NIH, as well as every other agency, has to report up to Congress, basically our brag list of we accomplished this project, we did this thing, we had this very notable paper or conference or so forth. And right now, the reporting through Office of Science Policy is a bit convoluted, might be a surprise, but there's several different systems. Each report has a different data call, and from the other side, they're essentially reporting the same thing multiple times. We think that a system like this would help to streamline that and bring it all together in one place and have a place where people could actually go and find it later. Because right now, without searching that individual report, you can't find that information again. We're building off of an investment that NIH has done in the past. We are striving to be platform agnostic. I've mentioned a number of commercial firms and open source firms. my big picture, my big focus is on let's do something. Let's get into here, make it as cross-platform compliant as possible. But if one institute really wants to do Harvard profiles and another one really wants to do the Elsevier tool, as long as they can talk to each other and we can create an interface on top of all that, fine. Because NIH, I didn't mention it, but NIH is made up of 27 institutes. The I in NIH is plural. Sometimes, officially, we're one NIH, but there are times where we act like individual little agencies. When Dr. Collins, the director of NIH, goes to Congress, next to him are several other directors, like Dr. Fauci, who are there advocating for the needs of NIAID, NCI, and others, right there at the bench with Congress. So that means that each of those institutes has their own IT, they can make their own decisions and go in their own direction. So having a top-down centralized solution doesn't always work at NIH. And then lastly, for me, somewhat philosophically, I would think that an agency, especially a research organization, the biggest thing that you create is publications, ideas. So you're publishing ideas. We should have a record of all of that stuff. In the past, I've worked with groups and we've created publication databases. This is kind of the next generation of that to me, in that if we can capture the intellectual record of NIH, PubMed Central and the deposit mandate is an effort to do that, but really that's from 2008 to present. This type of approach, we could go back to 1920 if we wanted. So I think this will help and do a better job than what we're currently doing. To be transparent, there have been a number of challenges. Working across agencies, as I pointed out, we started working with FDA, and together we were trying to roll out a system, and we developed a prototype. But dealing with funding, IT security, setting up servers across 2 different agencies, each with their own ideas of what the rules are and stuff, that was very difficult. On top of the fact that FDA is far different than NIH in terms of what we do. They're a regulatory organization, and they're much more secretive than we are, necessarily. You can't have industry know who a regulator is on a certain thing and when they're about to release something. So their needs and their expertise markers are far different than NIH. So one of the things we've learned from this is to step back and have FDA create a system and NIH create a system, but that we collaborate together. So that's the phase that we're in right now. We also realized that we were on the cusp of putting out a contract for a system several years ago, and the key champion, the one with the money, the one that was really behind this, left and went to NSF. The whole thing died after that. So we realized that we need to really build a network of champions and foster a group of people that are really behind this and can play the long game and make sure that this is going to happen. And that's what we've been doing over the last couple of years. We also started diving into the different types of people. So I mentioned intramural researchers, publications, citations, so forth, is their big marker. Extramural, grant managers and so forth, number of grants and dollar amounts and impact of those. But then we've also been talking to administrative people, so contract officers, IT people. They have expertise markers as well, and they could benefit from a system like this. So I, as I said, I have an IT background, so in addition to managing subscriptions for the library, I do a fair bit of work with Drupal, a web-based content management system. So finding someone who has contract expertise and understands Drupal, that could be something that somebody's looking for. So having a system to be able to pull out those different threads can be useful. So we're looking at and diving into and talking to people at each of these different areas to understand what are their needs and could a system like this serve those needs. There's always the dilemma of do you build your own, or do you contract it out, or do you find something in between? And we've been going down that path. We're avoiding vendor lock-in as much as possible. Everybody that we've been talking to can play in VEVO space and can at least export to VEVO. So that gives you the ability to if you go with one solution, a commercial solution, and you want to bring it in-house and do it yourself, you could do that. NIH, probably a lot of federal agencies, they like to build their own thing, but maintenance can be tricky. So part of this effort is to try and encourage people to look at what's out there and leverage that as much as possible. Economy of scale, we have 18,000 people that work at NIH. If we're successful in standing up a profiling system, this will be bigger than Harvard's profiling system, so it may be the largest profiling system out there. So when we went to VEVO conferences and stuff, we started talking about a prototype where we just want to have a couple thousand, profiles in there to try it out. We quickly learned that even our prototype or trial would have been larger than most of the ones that are out there. So our scale is different, but by mining and looking at that economy of scale, we think that we can do better than an individual institute effort. And then lastly, we got to make sure that we learn the lessons of the past, things like community science and stuff. How do you ensure participation and engagement? People that are using external systems like ResearchGate and stuff, how do you get them to make sure that the information in here is updated? We can go to the fully automated route and say, we think this publication is yours, so we're going to add it. Or we could go to an in-between layer and say, we think these are yours, verify. But if you verify, then that's a little bit of work that they're going to have to do. So how do you make sure that the people are engaged and they're keeping it current and they're actually using it? So our next steps, we're wrapping up our market research. We've been meeting with the big players, getting demo systems, really distilling down what their features are, what they do well, what they don't do well. Now we're looking at a couple institutes, so rather than trying to bite the whole thing at once and create profiles for everybody at once, we're looking at National Cancer Institute, National Institute of Mental Health, and National Institute of Child Health, children one, I forget what. And this is the reason we're focusing on them is because my champions come from those institutes. So I already have people that have been involved with us for years. They're with those institutes, and they can be an inside voice, and they can talk to management and say, yeah, we should look at this. And then last, we've been talking to data sources, the people that manage the grant management system, the people that manage the patent system and so forth, understanding their data. Because what I didn't mention earlier is that we have this robust plan of all these different data sources, but mashing them together is not as easy as it seems. Because if you got a publication database and you have a patent database, how do you know that these two connect to the same person? Ideally, we'd have a unique identifier, a number assigned for the person. But those systems don't necessarily have it, or if they do, they have different ones. I have an NIH ID number, and I have an HHS ID number, and they're completely different. So you need, on top of the fact that there's some level of data quality. So the funding opportunity announcement, for example, this is a very structured part with 5 fields, and it's clearly laid out in a table where it's got the label and the value. That's easy to harvest from a machine perspective. And then there's this big narrative part. And in the middle of the narrative part is the scientific research officer for this project is X. Well, that means we have to mine narrative to extract out the key person in there. So ultimately, we need to go back to the people that are managing that resource and try to convince them to extract that piece of information and put it into the structured part. So data is not, we're going into this knowing that data is not going to be easy, so we're going to try and step it up over time and focus on a couple of data sets, add another one, figure out how to automate it, and so forth. Let's see. So I've been thrilled with the type of people that have gotten on board with this. It came about initially with the OBSSR, the behavioral science group. A couple of them have continued on helping with this. And then because of Neil Thacker, who works for the administration of NIH, I've been consulting with him and letting him know what's going on. He ended up going into an executive leadership class. So we have a number of level leadership classes. And it's one of those where you go for a couple days and you take a month off and go back for a couple days. In this executive leadership class, they had a class project and they broke into 3 different groups and they needed to do something as a class project. And he heard that one of the other groups was going to do something on profiles. So he connected them with us. And as a result, I have Julie, Carlos, and Allison. Julie's the acting director of human resources for all of NIH. And now she's a big champion because as a result of working with us and doing her class project on it, she wants to see this happen. So it's been great over the couple of years to really build up a network of people that are on board with this and making this happen. So I think this is a great direction that research organizations should go. I'm happy to share, and now see what questions you have. Yes?
I have a question. You said you could mine the Orchid registry. So, but
Yes.
What is the but? Is it a technical issue? Is it trusting what's in it or the value of it?
So I've talked to Orchid at the VEVO conference, and there is a relationship there in that you have a VEVO instance, you can just have a big button on there that says, give me an Orchid. And then it would take your account information, create an Orchid, and then synchronize that information back. Talking to some of the firms, Clarivate, Elsevier, and so forth, they don't have a problem going from the profile system to Orchid, but they wouldn't necessarily trust the data that's in Orchid as being definitive and comprehensive. So you can do it, but you'd have to decide whether it's worth doing it or not. Because I haven't heard of too many organizations that have a robust program related to Orchid and that everybody's on board and so forth. I mean, ultimately, what I'd like NIH to do is, as part of our HR record, have an Orchid ID. And maybe even go as far as assigning it when you're onboarded. That may be too broad for people, but you have to get that name disambiguation. And then, on a related note, organization affiliate or organization identifiers would also be very nice too. I mean, if you look at the published literature, NIH has described probably 1,000 different ways. I'm sure American University described a bunch of different ways in the public literature. So how do you bring all that together? Ultimately, we need identifiers. Yes?
So, first of all, we've been harvesting some of your slides. I hope that's okay, or else we'll...
Yeah, I'm going to share the
Repeat
slides.
them.
I'm sharing the
Thank
slides.
you.
Yes.
And second, your next steps, well, data is exploding. Our ability to extract not just information, but information that is relevant to me is not catching up as fast.
Mm-hmm.
And my point is, perhaps artificial intelligence and machine learning can help. And I did not see that in here. And for example, if I'm a scholar in a particular area, I'd like to get not all of the information from these databases, but things that are particularly kind of relevant to me. And the system can extract that information and send it to me at 4 a.m. once a month, for example. To all of those people that are in the databases, researchers, for example, someone can tell me, by the way, you are great in this area, but someone is coming greater than you, and here's what he or she has done. Any plans in that direction? I mean,
So an alerting.
well, just one potential output of, say, machine learning and kind of mining of this data, and perhaps making even greater benefits for all of those communities, because people will share more information. They feel that they're engaged if they see their names not just on the kind of sending information to someone else, but getting back some useful information from these databases, right?
Yes. So I don't think I have. So on this one, I have the Coauthorship Network, but I didn't show, especially on the profile site, that they not only look at co-authors, but they can also look at indirect connections. Many of these systems can also mine the data. So looking through this narrative text and extracting out phrases, keywords, and then from that being able to say, well, it seems like your expertise is in infectious diseases. I know Elsevier, they have what they call fingerprinting, where it can read through a body of text and create a fingerprint, which is a weighted series of keywords for a person, or a paper, or for a department, or for an agency. So you can do that, and then by being able to automatically classify everything, then you can start to see, you can point to people that are similar, and then from that you'd be able to see, is someone growing in that area. This system's not specifically looking at it, but I know, NIH and probably any other research organization wants to know, where's research going? What's a hot field? What's a declining field? You can do that with bibliometrics, which is related to this, and we can definitely connect with this, but that's still a bit separate.
But my point is, here's a device. I wake up, and every single morning, Google knows what I read in the past 1 week, and they send me, by the way, you're interested in this and this, and here's something that is relevant to your profile. Of course, that is explosive mind, or perhaps could be golden nugget, but that's a separate issue, I guess.
No, it's a good point, and
they
being
do
able
it
to...
based on the artificial intelligence and machine learning. Their computers know who I am, when do I read, what I read, and based on that, they'll send it to me.
Yes, definitely. I know at least the commercial systems do a lot in terms of understanding impact. You're looking more of a projecting or alerting that this is areas that's changing.
Right.
I believe the systems could do that. Not sure to what degree a straight up VEVO could do that, but the Elsevier Pure and the Clarivate products, those are doing a lot more. They're selling products that are focused on institutional comparisons. Universities, organizations, they like to compare themselves against peers and so forth. So I agree that is something that we should be able to do at some point. Yes?
I apologize if you covered this before I arrived, but I have two questions. Do you see this as a way to track researchers who move around? If the Howard Hughes Institute buys someone off from NIH to conduct research there, what happens to the profile? And then ultimately, would this same kind of approach work at universities and research institutes on a smaller scale usually? Is that one of your
Would this
hopes?
apply to both universities and research?
Yeah,
I would.
is it a hope that it'll be transferable?
So, yes, definitely. Most of the installations of these tools are in universities. Government agencies are slower in adopting this.
They're already there.
And in terms of tracking, yes. So if I bring someone in, then I'm going to pull together all of their information, not just what they did at NIH, but previous things as well. And with the MyNCBI app within PubMed, you can actually, one of the reasons they created it is you could go and put in all your publication, and then you could actually select, I want to include these, give me a biosketch. And it'll give me a biosketch in the current NIH format, or you could spit it out in the NSF format. Because that was a big problem in terms of creating biosketches, because we have very specific rules of how they're created. So this kind of automates that. But then I believe the third option is you could export it to a VEVO profile. And then if I move to another organization, I can say, here's my profile. I'm a new faculty member, just load it.
So that's never happened before.
Yeah.
That's all theoretical. It's one of the theoretical virtues of a system like VEVO, but no one's ever done that.
I'm not sure if no one's ever done. I'm not on the university side, and it's just structured data, so you should be able to export and import.
But everyone's ontology is slightly different. Is the way it turns out in practice.
Okay, yes, the ontology can be different. You're gonna, but that port, a lot of the ontologies are gonna be the organizational structure, that sort of stuff. That's obviously not gonna port.
It's theoretically possible, but as a practical matter, I've never heard of anyone doing that before. And that's sort of one of the challenges that the VEVO community has realized is that in the early days there was all this optimism about all the interoperability that allowed between institutions, and you can find mentors at other institutions, but the practical reality is these things tend to be silos at their institutions, right? So, I've got a VEVO-based expert finder system at my university, but it doesn't talk with any other system, whether it be in the DC area or elsewhere. So that is definitely proven to be one of the challenges that has emerged with these sorts of systems.
Okay, I hear you and I agree. I guess I would pare it down some in that my publication list, patents, presentations, a number of those pieces you could synchronize with Orchid or LinkedIn.
Yeah.
You could get those kind of things, and then at the new system you could pull down. There's going to be, we don't. We still have 2 open source systems that are independently developed. The VEVO profile record is being supported on both the commercial and open source side. But yes, I haven't at least tested taking a straight profile and bringing it over. There's going to be differences between organizations. I agree with that. But the core pieces of it should be portable. I don't see why that wouldn't be portable. My equipment inventory, that's going to be completely different. My narrative text, that should be able to come. So, I think, did you have a?
Well, but let's see if Mary asked her second question.
I did.
You did,
Thank you.
okay.
Okay.
Yeah.
My question is a little more exploratory. Have you looked at the new search service called out of Stanford? It's YEWNO.
Yeah. I've started to look at it a little bit, but I'm drawing a blank on.
We are looking at it as
Okay.
a possibility. We're going to do a trial with them for sure.
Okay.
And we're interested in it for a variety of reasons, but one of the things that it does is it takes a body of electronic work. So it could be all of the grants that you all have given, all of the reports that have come out of it, if all of that were electronic, and it could map where there are intersections and where there are gaps in the way that you've looked at different things. We're interested in from that approach. We're also interested in it from looking at theses and dissertations locally, theses and dissertations nationally, and helping students find an interesting gap that might exist for somebody to begin a field of research. You can also use it to sit on top of all of the electronic resources you lease, to be able to have it do that same semantic analysis and conceptual display of what it is that you're looking at. And the more that you've been talking about some of the deeper things that you're going for, the harder stuff, it sounded like that might be a way of doing some of that mapping. It's not going to do what Asen's asking for, which is to tell you, it may actually show you some conceptual fields that are developing and that are a little bit still narrow, but it's not going to necessarily send you the same alerts as it does if you look for a pair of shoes, and that pair of shoes then follows you online for the next 2 months until they finally go away. I mean, it's interesting all the ways you're followed. Intellectually, you're shopping and everything is followed, and all gets mushed together. But it's one that I'd suggest you talk to them a little bit about.
I started to look at it, but I'll definitely look at it more.
What was the name again? I'm sorry.
YEWNO, YEWNO.
YEWNO. Great,
Yeah,
thank you.
it was developed at Stanford as sort of a skunkworks project between computer scientists and linguistics people. And they thought they had something, and at Stanford you have to find an academic leader to be your champion, and they went to the university librarian. And so Michael is the one that has led them all the way through the process to market.
There was another, yes.
So I'm a political scientist by training, so this might take us in a little bit of a different direction. But I mean, one of the things that I'm thinking about in this, in terms of sort of bureaucratic politics and congressional oversight and things, one of the products you talked about was the ability to centralize the reports to Congress and things like that. But a lot of the framing of this is sort of a bottom-up approach of connecting researchers with each other. But has there been any thought or discussion of what implications of a sort of centralized network like this would be for congressional or administrative oversight? Thinking about somebody like Coburn and has a bug for NSF funding or things like that, about how this might be, change the way that data could be parsed from the oversight side of things outside of NIH itself?
To present a fuller picture.
To present a fuller picture, or be able to drill down and even identify types of research you don't like, or whatever that means from a political point of view.
So we have a good, strong relationship with Congress. Up until recently, we've never had our budget cut. So there's a lot more reporting than I'm aware of. I know one of the pieces of it is called RCDC. So that is a research classification that's a standard language that's used to report how we're spending money on different diseases. And there's actually an algorithm that mines through the different grants and assigns the grant to a RCDC code. Even with that, there's statistics and politics mixed in with it. In that some of the ITs basically gamed it all to go one way, whereas ideally you'd want, if a grant is on 3 different topics, you'd want to proportionally divide it out. So there's that aspect. It's not my area to figure that out, but what I'll say is that with my next steps, where I'm working up my chain right now to give a variation of this presentation, so you're my test case, to the executive officers of NIH. So not the science officers, but the executive officers of all of the different institutes at NIH, to make them aware of this technology, this potential, and where we'd like to go with it. And that, if nothing else, it would help with internal collaboration and reporting. It will ultimately be up to the institutes and NIH to decide how much is public and goes beyond. I have a number of other, on the website, a number of web projects where we're taking grant information that's publicly available, creating a subset, focus on one disease like Alzheimer's, and then creating a system that is publicly viewable, and they can mine through and see who got what money and what year, and map it and all that stuff. That was specifically because Congress wanted to pay more attention to Alzheimer's research and wanted a system. As a taxpayer, I'd prefer to have more information available to the public than less. So I think this helps with it, but somebody else will have to decide what's too far. So.
Thanks.
Okay.
I have a question. This is very impressive, no doubt about it. And believe it or not, AU has this challenge of keeping all of the faculty profiles current, and perhaps use this database to inform faculty that, hey, we have new professor in SPA, and people at the other corner of the campus can know that this person is actually, could be a good co-author. In other words, breaking all of those across campus and school silos. My question is there a way we can utilize VEVO tools and things that you have kind of developed and apply them to our own huge database, or really small compared to yours, and kind of build a system that will automatically harvest information from various external databases and keep all of those files, just like Dr. Falch's profile, current.
So yeah, so I didn't develop it. So, but VEVO's free. You could go to vevoweb.org, I think it is,
Tailoring to
and
your
download
need
it down.
is a challenge, right?
Well, it's a process. I'll also say that all or almost all VEVO installations are run out of a library. Because you need project management experience, you need ontology and taxonomy experience, you need to be able to tap into lots of different places, you need to be a trusted independent source. You know, if it ran out of arts and sciences, you know, then it would be biased towards them or something. So having it in a library is a trusted organization within any organization. So typically that's where they're found. But even with that, you need IT. You'll need servers and that sort of stuff. And then, like I talked about, you need relationships with those data sources. You can't just secretly harvest your HR database or your curriculum database. You know, you've got to work closely with them to get the right accesses and keep it updated. And then with that, you know, even with like HR, you got to figure out, well, what do you do? If somebody comes in, do you automatically create a profile for them? Well, what if it's a student? What if it's a janitor? You know, what if it's a new director? You know, there's probably different rules and triggers with that. What if somebody leaves, or they stay on as alumni, or you know, so figuring out the rules and triggers related to that, it's a process. It's not going to be something that you just flip a switch. Now you could go to the commercial systems, Elsevier and Clarivate, and that could be a bit more turnkey, but you're going to pay 6 figures or more. You know, so it depends on, do you have the ability to have a couple staff that can devote to a system, or is it the money that you have? And then, as I'm trying to do, start small. You know, start on one use case or one group of people, and then grow it out from there. So, I mean, even, you know, the Cotter model for implementing change, you have small wins. So you can't, we're past the time where you have a multi-year development project and it pops out at the end of a 3-year window. It can't fly anymore. So hope that helps.
Are there other questions? If not, James, thank you very much for coming and joining us this
Thank you.
All of you are invited to stay. We have a light lunch, and it might be useful actually if we introduce ourselves, which we didn't do, because I think we've got different schools here. There are a bunch of AU people for sure, but I think there are others.
I'm Bill Harder. I'm part of the Center for Teaching, Research, and Learning here at AU.
I'm Carol Ito, I'm a reference librarian here.
Okay.
Mary Mintz, Associate Director for Outreach here at AU.
Oh, okay.
I'm Svetlana from Moldova, doing I'm from Fulbright Scholarship here. I take postdoctoral research in Global School of Business. And for me, it's very interesting how in the United States rate collaboration regarding the authors publishing. It's very interesting for me.
Great.
I'm Justin Littman. I'm a software developer and librarian at George Washington University Libraries, and we have a VEVO implementation.
Ah, so that's
Catherine Simpson, Director of Strategy and Communication here at the library.
I'm Stefan Kramer, Associate Director for Research Data Services here, and in 2011 I worked at Cornell and we were made to create VEVO profiles.
So Asana Senov, Center for Teaching, Research and Learning, in charge of the research support group, and we do provide faculty user support on research applications, ICPSR data, among other open source data, among other things.
okay.
Amanda?
I'm Amanda Click, I'm the business librarian.
Oh, great.
Jill Smith, I'm from Georgetown Law.
Oh, thanks.
So thank you all for coming, and please stay if you can.